Hello and welcome to the Clinical Update podcast, the podcast that brings you thought-provoking clinical education from MIMS Learning that you can fit into your busy life. I'm Rhiannon Ashman, Deputy Editor of MIMS Learning, and my guest on the podcast today is Linda Magistris, the CEO and founder of UK Bereavement Network, the Good Grief Trust, which brings over 1,000 charities and support services under one umbrella. Linda launched the charity, which is run by people who've experienced bereavement themselves, in 2016, and says of their work that we aim to offer a forum for all of those involved in bereavement and end-of-life care to come together to talk, share and learn from each other. So hi Linda, and welcome to the podcast.
Hello, thank you very much for inviting me.
Thank you for joining us. Linda, so you launched the Good Grief Trust following your own experience of bereavement, having lost your partner Graham in 2014. And you described your grief after his death as being utterly debilitating. And I know that you did speak to your GP. I'm interested to hear about your experience of that.
Yeah, so Graham was diagnosed with a soft tissue sarcoma back in 2013, actually, and he died in 2014. So yeah, it was a huge shock, and I'd lost my dad actually, 24 years ago this year, and he was my rock, and it was awful when he died. But when Graham died, I thought I was going completely mad. It was something completely different for me. So I really struggled with my grief, and that's what we understand now. So it depends on that relationship that you've had with that person as to the impact and the effect that it has on you. So I went off to my GP and I said, look, I'm really struggling. What have you got for bereavement support? And he had a leaflet for Cruise, which, as we all know, is a big national charity. Unfortunately, where I lived in London, in Wandsworth, they didn't have anything available to me for about 6 to 8 months for counselling. And at that point, I couldn't wait 6 to 8 hours. I was really, really struggling. I thought I was going completely bonkers, to be honest, which again, we know a lot of people feel when they're grieving. They think that the emotions that they have are completely alien, never felt it before. And particularly losing Graham because he was a similar age, and it impacts your own mortality and your thoughts around where you are in your life. And it's incredibly profound. So basically, I found out that they had some counselling in a neighbouring borough, and I lied. I was so desperate. I had a girlfriend who lived in Kensington, and I said I live there. So I went off and had 4 sessions of counselling. I'd never been to a counsellor before in my life, but it didn't really work for me. I didn't find a way forward. I just cried my way through the sessions. When I went back to my GP, having had those counselling sessions, I said, what else have you got? And he basically said, well, we can give you sleeping tablets or antidepressants if you're not sleeping. And for me, that wasn't going to work because I don't even take a paracetamol. So I went off and I Googled and I found an incredible charity called Widowed and Young. It was for people who'd lost a partner under 50. And I went back to my GP and I said, look, I've become London coordinator for this incredible charity. I found a way forward with my life. Why didn't you tell me about it? And he'd never heard of it. And that was quite a light bulb moment for me because it was a big national charity. It had been going something like 16 years at that point. Thousands of people up and down the country were being supported. And this health professional didn't have access to that knowledge. So I also went back to the hospitals where Graham was treated. He was treated at St George's Hospital, big London teaching hospital. And I went in the Macmillan office there that had every leaflet for cancer support groups. And I said, what do you do for bereavement support? Because my partner was treated here. And they actually said they didn't have anything. And if I'd like to start a bereavement support group, that would be great. And again, that to me was completely baffling because by that point, I'd met many people who also were having the same experience of not being signposted to support early on. And I then realised actually, having done some research on my own, I went off and I piggybacked on a programme for the National Council for Palliative Care. I met 10 different hospital trusts, their end of life and their bereavement teams, and they were all struggling to keep hard copies up to date. So they had leaflets, they had brochures, they had booklets, but they just were printed. So this was printed material that needed a 6-month turnaround or maybe a year before it get printed again. And often those numbers were out of date by the time the bereaved access them. And when you're grieving, if you pick up the phone and it's dead, or if it's the wrong phone number, or the URL doesn't work for a website, or that charity or support service is not right for you, you feel as though the door's been shut. And that can have very serious implications on your mental health and physical health. So I worked with these teams, and I realised then that they really needed and were asking for an online resource that would be constantly up to date, that would be constantly renewed. And that's where we went, really. So that's how I formed the Good Grief Trust in 2016.
I've read on your website about your work with the NHS trusts and the Good Grief condolence and signposting card. Could you tell me a bit more about those?
Yes, so I didn't want us just to be a database that there was a URL somewhere, and if it got shared, fantastic. If it didn't, the bereaved wouldn't know about it. I wanted every person that left a hospital or had the police knock on their door with a sudden death to know exactly where to turn with a hard copy of something that was tangible in their hands, that was hopeful, very simple, but very comprehensive. Because as I realised, and speaking to these teams across the country and GPs and health professionals, there was a huge disparity in the provision of that type of material. As I said, it could be one leaflet that only had a couple of charities on it, or support services or helplines. You could be overwhelmed with a massive booklet of information. And when you're grieving, you are often in a fog, particularly in those early days and weeks and months. And you need really someone to hold your hand, either virtually or preferably face to face. So we created the Good Grief card. So back in 2016, alongside the database, we donated these cards to the NHS, to GP practices, to funeral directors, crematoria across the country. So our branding is incredibly hopeful. Our strapline is help and hope in one place. So this was a card that the bereaved could be given. It had a little insert inside as well, a little plastic credit card that you used to take out and you could put in your wallet or your bag or your suitcase, but you always had the URL to the website, so you always knew where to turn for what we call help and hope. It was a condolence card at the time, but recently this year, 2024, we've now updated it with the feedback from the NHS that we're working with and the health professionals. It is now a combined condolence and signposting tool in one, because the nurses used to write on this card, here's my telephone number if you need me, here's my email. So we've now actually made a space for a personal condolence note by those health professionals or whoever supporting the bereaved. It also has a QR code on the outer card as well as on the little insert. And this will signpost that person who's bereaved and also the professionals to over 1,000 charities, support services, helplines under one umbrella.
Fantastic. So how could any of our listeners who've not seen these, not come across these cards, how could they get hold of some if they wanted to have some for their practice?
Yeah, very simply just order them straight from the website. So you go onto the goodgrieftrust.org and there it will be. So we have comprehensive information about the cards. We often do a lot of awareness around our social platforms, on the website, on webinars. As I said, we're working directly with those bereavement and end-of-life teams across the country in NHS trusts. Our vision is that every person who's bereaved in the UK receives a Good Grief card. We want to work with many more GPs as well. So during COVID, the Department of Health funded 150,000 cards to get samples out to every trust in the UK, in England, and also over 3,000 actually GP practices. So we are now replenishing them. So as I said, we've actually donated 250,000 of these cards over the past 8 years. This year, we're now asking for them to be funded. So we are a very small charity, although we have a huge reach and we are voluntary. So this year, we're very grateful to be working with the NHS teams and the GP practices because they are investing in the card. So the card is only 30p each, and NHS trusts are ordering enough to service their needs. So, for example, a trust may have 1,000 deaths, they'll order 1,000 cards. Hopefully, we'll be able to give every family, every time, that early signposting, that vital awareness of where they can reach out to tailored services. So that's whether they've lost a child, a sibling, a partner, a friend. On the website, it's very, very simple. So that health professional can sit with the person who's bereaved very early on. They can show them the website. They can look at the specific loss that they've encountered and they've suffered. They put a postcode into our UK map, and immediately that service will pop up. They'll be given a list of charities, support services, hospices, hospitals, local community groups that will be able to offer them whatever is right for them, because we know that grief is so unique. So we offer a choice, and that, as I say, is under that one umbrella. And also, the website will translate immediately to 104 languages. So if you are sitting with somebody, or if somebody is accessing the website for themselves, they can just put in who they are and the type of language that they would need. And every page on the website is immediately translated into that language, which we know is incredibly beneficial as well.
Our listeners will know that we've been running an editorial campaign this year on targeting health inequalities. So you mentioned that your website can be translated, which of course is going to be extremely helpful for accessing communities where English may not be their first language. But do you have any other thoughts on how primary care could best support marginalised communities with their bereavement and grief?
Well, I think it's awareness, isn't it, really? The services are there, it's trying to join the dots. So, what we would really encourage is for every GP practice, social prescribers we're working with very closely again now, the bereavement teams and end of life teams, to be aware of the services that are available, because we have many very specialist tailored charities that will tailor specifically for those marginalised groups, for ethnic minorities, for the BAME community, and they will be able to speak in that language. They will be able to tailor that service specifically for the cultural needs and the religious needs of that community. So it's really around awareness of the website, awareness of the database, and awareness of the services that we offer under the Good Grief Trust. So we are working very closely with the Metropolitan Police this year, who are also taking the Good Grief condolence cards. So they've invested in 1,000 cards this year to offer each of their bereaved families within London that tailored support. So again, it's incredibly important that we offer a choice. So it depends on the language that person is speaking, the cultural needs of the bereavement. And also, many of these people are experiencing a bereavement in one particular town, for example, but they have an extended family network elsewhere in the country, which we can also help. So as we know, grief affects that one person, but it also affects their family, their friendship groups, their work colleagues. There's a huge ripple effect with bereavement. And by signposting to the Good Grief Trust and using this one central resource, it will offer such a raft of support across all services.
So signposting, obviously a crucial aspect then of the GP's role, and you've spoken about how the Good Grief Trust can really support them in that. But are there any other sort of practical aspects for us to consider? So I'm thinking about the role of primary care in making sure that the bereaved person or family understands, for example, what's written on the death certificate, or understands what it means if their loved one's death has been referred to the coroner. Have you got any thoughts then on what primary care's role is there?
Well, again, I think it's around training and awareness, isn't it? Because we often meet many young nurses, young doctors, where bereavement isn't even in the curriculum. They haven't even encountered any awareness or information or guidance around a bereavement. End of life is generally in the training, but really the bereavement side is, and has been for many, many years, a poor relation. So it's around trying to increase awareness. We run webinars at the Good Grief Trust for different sectors to come together and learn about the services that are around, to learn about the language that we really should be using for the bereaved. For example, using very kind language. We're not talking about viewing a dead body, for example. We visit that person and we use the name of that person. The language is so key for anyone who's grieving, and also for that GP in the community is so important. His role or her role with the bereaved family and their network, not just for day one, but ongoing as well. So that's why these cards have been proving so popular and so important as an essential resource within the toolkit of a primary care worker, because they will be able to put, for example, one of our condolence cards in with their kit. If they already send out a condolence card to that family, they will also include the Good Grief Trust, which adds an extra layer of support and immediate awareness around that as well. I mean, we would want posters, for example, in GP practices, in PALS offices, within trusts, to raise awareness of where those support services are. If there's an AV system in a waiting room, it would be lovely to flag up some slides there. It's around awareness. I mean, the Good Grief Trust, as I said, is all about help and hope. And you really do need to offer hope to those people who are bereaved going forward, because we know the implications of not receiving the correct type of support at the right time, as I say, can be incredibly detrimental to our mental and physical health. I mean, obviously, drug abuse, alcohol abuse, the rate of suicide is increased, children's self-harm. There are many, many aspects that actually we can mitigate by offering very early and comprehensive bereavement support, which obviously GPs and health professionals can be really key to do.
I'm glad you mentioned about the language, because I'm interested in the language used around death and bereavement. It can often be quite personal, really, can't it? Your preference. But as you said, healthcare professionals, we often hear from them that they feel, ill-equipped on these sort of consultation skills sides of things in terms of dealing with bereavement and grief. It's really not something that they receive a lot of training in. And I'm quite interested in the idea you've said of the charity. We aim to normalise grief and raise awareness of the impact of grief. And I'm interested about this idea of normalising grief and to what extent people need to be reassured that their feelings are normal and that they're not going mad, as you said you'd felt, where the line is in terms of it crossing over into becoming a sort of a medical issue, as it were, where it's really impacting their functioning and their long-term sort of health.
Well, as you say, it's really important that we get the language right and that we understand that the feelings that we're experiencing as a bereaved person are generally very normal. You often feel as though you're going crazy. You often feel as though maybe you want to speak to that dead person, and that's completely normal. Whatever you feel is generally good for you and right for you. As you say, when it crosses over into something a little bit more complicated, we might need to seek extra counselling or help or support. But generally, from day one, most people just need to know that there is hope and a way forward with their life. They need to know that there are people there who care, and then they need to know that there are support services if and when they need it. Not everybody will need it, but we often know that once the funeral is over, that is really the time that most people will struggle, because early on, there is a lot going on, there's a lot of busyness going on, there are a lot of people around us. But as soon as the funeral is over, people go back to their own lives. So sadly, for people who are bereaved, their life has stopped and the world has stopped around them, and they can't understand why people are going about their normal business when actually, if they've lost a child or a sibling or a friend, or actually it depends on as I said, the relationship with that person. Traditionally we've thought if you lose a husband or a wife or a child, they are the type of people that we need to support. But actually, if your friend or if your cousin or your aunt is like your mother or your sister, the impact can be absolutely profound, and that can change your whole life, and it can affect all aspects of your life, your finances, your work-life balance. Many people lose their jobs because they cannot get up off the sofa. They cannot find a way forward. They cannot find people who even understand them. Many people walk away. They find, as we were talking about the language, it's very difficult for people to know what to say to someone. And that's not just for friends and family, that's also for those professionals. But we do have to become wiser, and we do have to become more normal in our thoughts, really, because grief is a completely normal emotion. We are all going to pretty much experience bereavement in our life. but it just depends on that effect that it has on us when it actually happens, because we won't know until it happens. So we just have to be prepared and have more awareness.
And I think actually it's really important to acknowledge that it's really likely that any healthcare professional who is, with somebody who's experienced bereavement and grief, they will have experienced bereavement and grief in their personal life as well, and inevitably kind of carry that experience with them. Do you have any thoughts on kind of how health professionals could support themselves in that situation, how they can look after their own well-being or support perhaps a colleague, who's been bereaved as well?
Yes, definitely. We're doing a lot of work around peer to peer support and professionals supporting other professionals. So, some of our ambassadors are clinical leads in NHS trusts, they're bereavement lead nurses, and they work very closely with their colleagues. So, pre COVID, we started the Good Grief pop up cafe initiative where we had pop up cafes around the country, bringing people together in communities for a cup of tea and to share their grief. And they were incredibly popular. They then went online. So, we've been running virtual cafes. And this is an initiative that's been picked up by many, many hundreds of people across the UK now. So some of our teams are running cafes, face-to-face cafes for staff within trusts, and those are safe spaces. So those are spaces that they can share, particularly maybe they've had a personal grief experience, but also the grief that they feel in supporting their patients and the relatives on the wards, for example. So these regular cafes are run by some of our ambassadors, as I say, nurses up and down the country, and they have been incredibly vital to manage staff's mental health, their physical well-being, but they have a place that they could just offload and they can feel as though other people understand and other people care. And again, it's a really important place for signposting as well. One of our key initiatives is National Grief Awareness Week, which is a campaign that we launched back in 2019. So this year will be our 6th campaign, and we launched it to help people in the lead up to Christmas, which, as we know, is incredibly difficult for those people who are grieving, but also December, January and February, those really dark, lonely months when we know that people are often very isolated at home. So the campaign was launched in 2019, but last year we launched the theme Better Together. So we increased the awareness around not only the services that we offer, but across the country through Better Together cafes. And this, again, is an initiative that has been picked up. And we have many nurses now. So Liverpool NHS Foundation Trust run monthly cafes, and those are out in the community. They turn up at a hotel and they offer cake and biscuits and tea and coffee to the local community. But they also support their staff within those cafes, within the trust as well. And those are absolutely vital. And they've proven, as I said, a place to go on a regular basis so that you know that you can connect with others who understand, you can connect with others professionally. So we would maybe advise GP practitioners, social prescribers and primary healthcare workers to maybe think of running these type of events within their own organisations. They have been really, really popular. So yeah, grief cafes are the way to go, really. And actually, we're launching this year a new national map of grief and bereavement cafes due to the increase in these support services being established in the communities.
We've been talking a lot about how healthcare professionals can best support people, but of course, they can only really help the patients that come to them. So, what do you think it is that prevents people from going to their GP to seek support?
Well, with our experience, sadly, the feedback is that they probably think that the GPs and the health professionals won't understand. I think it's a lack of awareness on both parts, to be honest, because there are many people who are bereaved who don't even know that the care is out there for them. Nobody's told them. So, although the Good Grief Trust works within many of the hospitals up and down the country, across the 4 nations, as I say, we're working with the police now, we're working with emergency services and many crematoria and funeral directors. We're not everywhere. So, there are pockets, sadly too many, across the country where the bereaved are left with a lack of signposting and a lack of awareness. And I think that contributes a lot to the fact that people don't actually understand that they could go to their local GP, they could speak to their local doctor and find support. But again, it also reflects with the GPs as well, who hopefully will be able to know about the Good Grief Trust going forward and will be able to take those really vital resources within their toolkit in the practices and signpost out and have that awareness, so that there's a mutual respect, there's a mutual understanding, and there's that mutual care. Because there are so many wonderful community groups going for walks and talks, for example, meeting at the local garden centre for a cup of tea. So many initiatives that have been created over the time that I've been running this charity that people still don't know are out there. You know, there are park runs every Sunday for people who are bereaved. There are wonderful knitter natter groups. You know, there's something for everyone. And it's just a case of reaching out into the community to those people who are bereaved, letting them know that the care is there, and also reflecting back into the practices. Something that somebody recently suggested to us, which we really like to pick up, is also a text facility. We know that many people at home who are waiting for an appointment to see a doctor or a GP surgery to, get in touch with them is used by a text. So again, if we know that somebody in the community has died and their relatives are part of that practice, just to send a text with a URL or a phone number, just to say, look, we're really sorry. We understand that you've just lost, use that name. And here's an organisation who might be able to help. It's trying to find a raft of ways so that at those touch points, we know that that person who's bereaved is understood, is contacted, and that is supported. And as I said, it's just general awareness, really.
So there's sort of proactive approach as well.
Yeah.
So you mentioned earlier one of the initiatives, the grief cafes. I know there are a number that you're involved with. Are there any others that you think would be of particular interest to GPs that you'd like to share with us?
So, yes, we have many initiatives that the Good Grief Trust have created over the years, and one of them is the Help and Hope plaque. So, the campaign is called Sit with Hope. And we know that many people are out in the community, and again, if they haven't been signposted to support by the organisation that has dealt with that death, what we wanted to do was to plug the gaps. So whether that's John O'Groats to Land's End, whether you're going for a walk with the dog down to the beach, or whether you're in an inner city, we wanted people to know that there was help when they needed it most. So last summer, we launched our Help and Hope plaques. They're a plaque that say Help and Hope, the Good Grief Trust, and they have a QR code direct to the website. So these are now being installed on benches in hospital gardens, in car parks, in hospices, in memorial parks, in crematoria, funeral directors, and parklands up and down the country, so that we know that people who may be sitting on a bench and who are sharing thoughts maybe with a friend or a stranger, they can look on this bench and they can literally scan their telephone onto the QR code, and immediately the website will open up. So it's trying to plug the gaps out in the communities. So if we know of anybody who would like to get these plaques, please do, because as I say, many hospitals are now putting them out onto their benches in their gardens, in their memorial spaces, in their reception areas, so that not only those people who are bereaved, who maybe go out and sadly have experienced a bereavement within the trust and are trying to take time out to reflect, but also for staff. So we know that staff now are going out for their lunches and they're sitting on these benches, and they are now understanding more about the services that are available to those people they're trying to support. So that's one of our key initiatives that we launched last year, and it's growing. We have over 800 plaques, including 2 on the House of Commons, because we also run the all-party parliamentary group on bereavement support. So again, trying to work with government, raising funds and raising awareness of the need to reach out to those people who are bereaved across the UK.
It's great to be able to focus on practical things that health professionals can do, because the point around knowing what is available locally is really tricky. There can be real sort of long-lasting mental and physical impacts of grief that's not handled appropriately. And so I think it's a real, there's like a piece around sort of preventative medicine.
Oh, it's huge. Absolutely. And that's not really understood, Rhiannon, and that's the problem. Because I think, as we know, GPs have very limited time and resources available to them. So the 10-minute slot that they've got to be used in the best possible way, and to sit there with a patient who has suffered a bereavement, and to be able to give them immediate access to the right type of support for them could definitely mitigate those further issues down the line, and to also understand that maybe they're coming in and they're presenting with physical issues and problems that actually you could attribute to the grief that they're feeling. So again, it's a double way. It's trying to understand the huge, profound impact on the body, the physical and as well as the mental issues with those people who are bereaved. So yeah, I think it's trying to support health professionals in the best way we possibly can, because these resources are available and they are being used, and the feedback that we get is 100% positive from every health professional that we've worked with.
It's a real skill, isn't it? Having these difficult conversations and knowing when the right time is to approach people.
There are a lot of GPs who are saying to us, if somebody presents, with issues, we'll give them a card. Or if somebody, comes in and they're suffering, then we will do it. But that's actually the wrong way around. By offering that immediate support, they can pick that up when they want it. It's absolutely vital that they know from day one that the support is there, and it's up to them to access it. So for us to judge, there's a lot of judgment and assumptions around grief and loss, which are completely wrong. It's like the 5 stages of grief. There are no stages of grief. It's just a mixed up, messy ball that changes on a daily, weekly, monthly, yearly basis. One day we want counselling, next minute we want to go and swim with someone who's had a bereavement. We can go and have a chat and have a coffee after. Next minute we don't want anyone. We just want to hide under the duvet with a cup of tea. So you've got to offer that signposting and that choice. Let me just read this quote, actually, which is really, really important because it's one of the most shared quotes across our social media platforms. If you know someone who's lost a very important person and you're afraid to mention them because you think you might make them sad by reminding them that they died, you're not reminding them. They didn't forget that they died. What you're reminding them of is that you remember that they lived. And that's a great, great gift. And there's a lot of, as I said, assumptions around that we shouldn't be asking people from day one. We shouldn't be doing this. But that's been blown out the water now. We actually do reach out to people on day one, and that is absolutely vital.
If you could offer a handful of sort of take-home points that you would really love for healthcare professionals to take into their practice, quick and easy things that they could do the next time that they encounter a patient who's recently been bereaved, what would your sort of top tips be?
Well, first of all, to remember our mantra at the Good Grief Trust, which is grief can be complicated, but access to support should never be. So that is really the number one line. Just to remember that actually the support is there. We just need people to signpost as soon as possible. So definitely take the Good Grief condolence and signposting cards. They are an incredibly comprehensive tool, inexpensive, and they are available immediately to every GP practice in the UK and every NHS trust and anyone who's supporting the bereaved. So please do go to thegoodgrieftrust.org and order your cards. Again, signposting with posters, so visual signposting. So just to make sure that those people who are bereaved and also people who are experiencing end of life or a terminal illness or a critical condition know that actually there will be support ahead. So again, the Good Grief Trust signposts on our website to people who are expected to die, to those family, to the friends, and also for those people who have a terminal diagnosis so that they can try and prepare. So again, that's really key for health professionals to know if they have a patient or a family member who is experiencing a terminal diagnosis. Please do signpost them to the Good Grief Trust to try and help them, guide them through that as well.
Yeah, well, thank you so much for talking to me. Really appreciate you being open to sharing your experience, and it's been really good.
Yeah, lovely. Thank you. It's really good.
And for all of our listeners, we hope you'll join us again next week for the next episode of the Clinical Update podcast. See you then.